rushing, so I just want to in ahead because we want to like review and know to diagnosis actually. 那个音乐能放小一点吗？ She, her like relative, sister is my patient. So she is 47-year-old. She said the chief complaint is left side headache. So like February 12th, she is in ER in the middle night. So this is her chart. Let me see. Yeah, I think that's not the. 不是我的最后本. Okay, so the chart, the chief complaint is the migraine. But she went to see me. Her issue, she said she has a face pain, and you see this face pain, and can't like close her eyes, and also you see here it's like Bell palsy, right? But you see here, the tongue, that's a deviation there, and also when I see here, you see compare, right? This is the upper have some like light, right? And also she has like the left side of the whole body, the muscle tone is the same. Like if I give her the test, the muscle tone is the same, like both sides is the same. But she said the left side she feels numbness and pain, the whole. So that's and also that day she said the whole day she can't sleep. This is her chief complaint because I don't have time, because at that day I'm so busy, so I don't have so much time to give her like the whole body testing. Then this is a record from her like chart, so give her the medication. You see this is a like blood, like a pressure is a little bit high. Yeah, so this is like a pulse. And all this, everything is okay. She has consciously, and speech is okay, no slur speech. And then the patient, they gave her the, you see, this is like the old medication, and give her the CT scan. And this is at emergency department tonight, and take the Tanolone and ibuprofen. That's it. Send her home, follow up. So this is just because of the chief complaint is the migraine. But how to say, they gave her the EKG, the old lab work, everything is normal. You see the head CT is normal. Neck CTA is normal. And also only the, let me see, 血沉有一点高. Yeah, ESR has a little bit high. Here, ESR a little bit high. Other things, that's normal. EKG, normal. Yeah, so, okay, chief complaint is like, numbness, facial pain with numbness, eye pain, can't close her eyes, and left body numbness, out of balance, she said, for 2 weeks, with vertigo, and the whole night she can't sleep. So very, so I just give her the, but I want to let the neurologist say that's what's the diagnosis. It's the Bell palsy or it's the stroke, mini stroke, whatever. What's your diagnosis according to my tests and all the symptoms?
To the picture.
Yeah.
Like this.
It's so that deviation's on the same side?
Not the same size.
Not
You
same
Opposite side?
You see, this is normal. This side, the right side is normal.
Okay.
This side is abnormal. So you see the eyes can't
Can't
close.
close.
And here, you see here, right? So
Yeah.
this is abnormal, right? But you see tongue is like this, right? So what's the diagnosis?
So paralysis is at the left side.
Left side.
Left side, yes.
And the pain, the brain, the headache is on the right side or left side?
Headache is the left side.
Also left side.
Yes.
Okay.
Numbness, left hand, left.
Yes, but I test her like force. The muscle strengthen, it's normal. The feet muscle strengthen is normal. But she feels like vertigo. She feels vertigo and she feels like out of balance.
航体的综合症，应该是
但它有舌片啊，
航体综合症伴随血管疾病啊，没有。
它有舌片主要是。
Yeah, because of she has a deviation. If that's a palsy,
Bell's palsy.
Bell's palsy, yeah,
Breast palsy and tongue deviation.
yeah. What's the diagnosis?
他是第几天做的 CT 啊？
I think after 5 days, because that's the February 12th, she got the CT scan. Actually, that's already several days later. So it's not like the first day she went to the ER to get the test. It's already 5 days.
I suspect maybe some lesions on her left pons.
Left pons.
Yeah.
Okay.
So the CT scan is normal.
Yeah, it's normal.
It's normal, but the CT scan can't find the small lesions on brain stems, especially pons and medulla.
Okay.
Because we have some bones here, some bones can interfere the signal of the CT scan. So maybe if this patient is mine, I recommend her to perform some MRI.
MRI. Okay.
We can see the brain stem clearly.
Okay. I can give because next week, next Monday, she will come back.
主要有舌苔，你还高度怀疑脑干的问题。
Yeah. So.
并且还有一个很重要的体征，整个左侧都是
半边
麻的
都麻木，
那明显是从上边来的，
Yes. Yes.
就不是个周围的东西。
It's similar like.
Yeah.
Yeah.
Thinking.
Yes. Yes.
Yeah.
It's similar, right?
Yeah.
Yes.
Yeah.
So I just give her, the.
要做的是
Yeah. Okay.
真看不见 CT。
Yeah. So
Free
I
bodies.
I give her the scalp acupuncture.
Yeah.
Okay.
It's
So
good.
that's you see the right side, right? Because our symptom is in the left side, so I
Yeah.
give her the right side. Firstly, I put the needles here because that's actually for vagus nerves. Let her like calm down. And then I put here, that's the motor line and the sensory line. Here is the motor line. That's a whole line, motor line. Then the sensory line. And also the middle line, that's actually because her like the pain for the face, and also she can't sleep. So like let her calm down. That's mostly focused on the frontal lobe of the brain, like calm down her nerve system. Then I give her like driven the manipulate the needles very fast. That's typically the yeah. And also I put like transversely, that's in the right side, the left side, transversely, because one thing I think that we should have some, how to say, the signals to hear, but that's transversely, I try to target the fascia layer, so it's very much, and also try, how to say, 三叉神经 trigeminal, like
Trigeminal.
trigeminal, yeah, trigeminal. Because of cyst, that's a trigeminal for that. You see, yeah. So you see, like after that, this is the before. This is after. So a little bit better.
Yeah.
Yeah, a little bit better, right? Then
汤
Oh my gosh.
Okay, wow.
this is
It's
already,
incredible.
yeah, that's a one session. Just to let you know, that's how to say, like the actually,
你怀
we're
疑他是脑
Did
干
you
的
did you use
你
electroactive
说要
What?
要排除脑干，因为它一个周围性面
Yes.
瘫，又加上一个舌苔，还有左侧的整个的一个麻木，就需要排除脑干的问
It's
题。
crazy.
脑干 CT 正好看不到。
所以我就问很奇怪，他这么明显的这个，他们这个医院就
你这前
说
后有多长时间？
他没问题，让他回家
同一天就
止毒药
是治疗前、治疗后。
是啊，这明显是他写了一个查体是正常的，我觉得奇怪。
跟你讲，他这是一天的都已经。
就是我治疗前、治疗
就
后，
扎了针
就是
灸
当时。
扎完一下，
如果是把，但是他那个偏侧肢体麻木算了。
但是
他有可能是主观，因为客观他肌力是 normal 的，是不是啊？他客观上你查他的肌力是 normal 的，对不
对
对？
肌力我比较，
对，他是
它是
normal 的
normal，
对，就是客观上他是 normal 的，他觉得没力那是主观的。
不是他
不是麻木
他不是
numbness，
，yeah，他是 numbness，
numbness 你没有测，你不知道它是一个主观的 numbness 还是一个客观 numbness。
他就是觉得 out of balance numbness。
还有个 vertigo 是不是？
Vertigo, yeah, vertigo and migraine, yeah.
所以你排不除脑干的问题。你如
是
果
I agree with
是的，我们观点肯定一致，只是说我们讨论更细的东西。
Yeah, so just to give you some thinking about, because actually I have seen this patient not only like this, several patients like this,
很快。
right? Several patients like
但
this.
是很奇怪，一直在讲，治疗完他到晚上他说句又他舌头又
Yeah,
疼
then that's the second day. Her relative called me. She said, after the treatment, the same day, like this, right? Then at night, return to this. So I said, come back.
47岁女性
TIA transient
TIA 好不了这么
attack。
，TIA 也几个小时了，你做磁共振能看见病灶了。如果 TIA，
But from my experience, no one patient can
Yes.
can repair so
quick,
so
so
quickly.
fast.
It's
recover
not-
so quickly.
It's actually, it's impossible. Or it's possible. It's possible from scalp acupuncture. It's possible because actually, when you see like several patients, you will see it's possible. Because that's how to say the manipulation of the needles very fast. That's like some signals to that. So that would be blood flow will be better.
So, Dr. Ding, so you already have some experience, maybe several patients just like this, they can recover in the right after
Right.
The acupuncture.
Yes.
Oh my gosh.
Yes. So that's why I said scalp acupuncture have many potentials, but should be like have very good examination, then more precisely, so we can like because if you said okay, that's the issues from the prong, so I may put needles here.
And her symptom of vertigo
Yeah.
disappear or
Yeah, much better. Yeah, so she can
numbness still there.
numbness also better. Yeah, so I can ask her because that day it's so busy. I have no time to ask her so much details. But next Monday I can ask her about that and also give her the recommendation.
Interesting. Maybe some 脱髓鞘病变也有可能。
没有
脱髓鞘会变。
不是我说是 recover so quickly.
这个我不好说。
这个 recover 是可能的，
可能的
是可能的，对，这
他下周还来是不是？
对。
你到时候看他情况就很有意思了，连续
Okay,
随访。
so I just
Follow
leave
up.
the questions here. So anyone have any questions, you just can ask. Okay, yeah. So if you have no questions, I will introduce Dr. Beck.
他这种症状就相当
You just self-introduction.
Oh, okay.
Yeah, why I in,
他们只是让他吃止痛药，这种处理方法。
这个不谈，这个他们有好多的那
他
个。
可能是没有发现神经系统异常，没发现
但。他对这些体查这种症有看吗？
我怀疑他没怎么查吧，我怀疑，因为神经科查体本来就比较特殊的一种查体，相对来说，就和普通内科医生比来说，普通内科医生也查不了那么好。反正在国内是这样。
He just close the slides.
密码在上面。
That's what they did to my mom too. Oh, they did? After she had her mini stroke, they straight up just like gave her pain meds. And that's it.
So they gave her just that medication for her shoulder
Instead of night. Yeah. They're like, we can't do anything about it. And yeah. That was ridiculous.
But what was the follow-up? None?
She stayed in the hospital for like 3 days. Had PT come over. And like, your follow-up is to go to PT. And work. Yeah.
Is it like same same slides?
No, this was in.
You sent me two.
Oh, did I?
Yeah,
Probably the shorter one.
only one, right?
Yeah. Yeah, probably that one.
Yeah, download first, please.
I'm sorry, I just kicked you. That was me.
Here's some number.
Why you say that?
I'm a mom. I know.
Correct. Thank you.
明白。
Okay. All right. Okay.
All right. Hi, welcome. Okay, great.
You just self-introduction first.
Dr. Bravard. I'm a chiropractor. I've been a chiropractor
Yeah, you can say.
about it's a little easier to talk to stand.
Okay,
That's
all right. Yeah.
Yeah, I've been a chiropractor about 18 years. Went to Palmer College in Davenport, Iowa. I was a soldier in the Army and had some low back pain for a long, long time, and nothing was helping, and it kind of ended my military career. So, and then I discovered chiropractic, and I was like, oh man, I could have felt like this for 20 years. So, after my first chiropractic adjustment, which actually was in Germany, I decided to go into chiropractic, and had private practice for 12 years in Illinois, and then I decided to, I studied chiropractic acupuncture and did that for many years too, and then came to Minnesota to learn traditional Chinese medicine, which is my passion. So, and something it's like, I don't know about everyone else, but one thing that influences me of my continuing education is my patients and trying to get them better. It's like, so I was hesitant to study kind of nutrition response testing because there's a lot of they say it's controversial. So I really didn't have any interest in it until I was desperate enough to help a patient. And so basically, nutrition response testing, it comes from a technique called applied kinesiology, which was developed by Freddie Ullin in 1965. He's got training systems in, I think it's Fort Lauderdale, Florida. And not just chiropractors, not just chiropractors can learn, also acupuncturists and other professionals too can learn this system. It's just a great add-on. So it basically evaluates the body's. Well, thank you. I guess I should probably do that too.
Yeah, no problem. I can.
You got that? Have a seat then.
I can help you.
Okay, thank you. The less I look at a computer, the better it is for me. So, and so it basically evaluates the body's neurological reflexes to identify nutritional deficiencies, organ stress, or imbalances affecting overall health. And so basically gentle pressure on a specific muscle while introducing stimulus, like food substances or supplements or, you know.
在中间移动。
I'll stand back here.
You're in the movie star.
Okay.
Because we have a recording. Yeah.
Oh, okay, thank you. Okay, make it easier on you. And so basically we're seeing how the body responds. Okay, it's like these responses are interpreted to determine nutrition or lifestyle or basically anything. I use it in many parts of my life that we can talk about. So, how does it work? Basically, we're using muscle testing. The practitioner tests muscle strength and reflexes to detect weaknesses or stress in the body. And each reflex, like we have referring reflexes, like the organs reflect on the body, so we press on different, let's say lungs here, say the heart's here, spleens here, pancreas, so we press on these specific organs or system to determine a stress to the body. So in nutritional response testing also, it's like they believe there's 5 stressors that cause health problems. Okay, one is scars. Our skin conducts electricity, and so a scar can block that. So scars are one. Food intolerances, chemical and heavy metal, toxicity, and also immune challenges like bacteria, virus, fungus, and parasites. And so based on the results, we can get a very tailored nutrition plan for the patient. We're using supplements or dietary adjustments. And then we show progress through repeated testing and adjust the program as needed. And great thing about it is that it's non-invasive. There's no drugs, no blood draws, no radiation, or pharmaceuticals involved. It's basically, what I love about it is like asking the body. It's like I don't have to, guess about it. It's like the body's telling us what's going on. And sometimes, it's like we learn all these different tests as a practitioner, and this is just another test. Just another test that can help. That you don't need equipment that you can just easily do. So there are some limits and considerations. NRT is not widely recognized in mainstream medicine due to lack of large-scale and peer-reviewed validating its effectiveness. Yet they don't have the big bucks to do it. But there are many studies. We'll talk about one in particular a little bit later. And also a limitation that the training and expertise can vary. So it's important to get a qualified practitioner. And I think it's important also, besides doing this, I like to back up with anything else I'm doing. If needed, a blood panel, intracellular nutrient testing, other reflexes, palpation, are all important part of it. And I guess in summary, In summary, NRT offers a personalized, non-invasive approach to identifying nutritional needs and supporting overall health. Its scientific validation is limited. It should be treated as a complementary approach rather than a replacement for conventional medicine. And it's just another great tool. And even though there's not a whole lot of science, peer-reviewed studies behind it, I mean, I myself have had great results, especially finding some of the things I can't quite explain. Sometimes, like one case I had, it was just sometimes as simple as this. It's so nice. I had a colleague who ate incredibly healthy, and she kept getting, she had terrible problem with acne, and then especially GI problems and terrible pain. There was really nothing to explain it, and so I run through the NRT, and found out that she had allergy to, or not an allergy, but she had intolerance to fish, and she would eat tons of. That was her main thing, was eating fish, and she took lots of fish oil too. And so with her, we got her off that, or she stopped eating that. We recommend patients for like 3 months to be without that food, and then we give them things to help support digestion, digestive enzymes to help support the liver and pancreas, and then something to help drain. Always got to have something to drain, to help the liver drain, help the detox. And so I use mostly, and the system's kind of quite a bit based on products from Standard Process, which I love, is whole food nutrition, not just something put in a test tube, and this is whole food nutrition. Actually, Standard Process was around before the word even supplement was even invented. So basically, yeah, after just getting her off that and off the fish and giving her digestive enzymes and what we call Spanish black radish, that's probably one of their big products they use. I love it. Food, healing the body, like our higher power intended for food to do. And so how the testing, I don't have them with me, but they're basically in these, you guys know what VHS, remember what VHS? They're old cassette tapes for...
What's that?
VHS, what is that? What are those called? Those are... Movies, yeah, like the tapes? Cassette tapes?
To put in your TV.
Yeah, to watch movies.
Oh, okay.
Yeah, they're, so it's basically in a cassette tape like that, and they have all these little, they're homeopathic vials. So like one section will be all these different foods, and they're in these homeopathic vials. Kind of interesting. It's like let's say if it's wheat, okay, they'll have wheat in its seed form, wheat, mid-growth, wheat when it's mature, wheat when it enters the mouth, wheat when it's in the gut, in the stomach, in the gut, in the colon. So it catches that the whole the whole pathway, and it's, I guess, the wavelength and frequency. I don't know how they determine this stuff, but the wavelength and frequency of those items. And so that's one cassette, and then another is a whole bunch of different chemicals. Another side of it is the heavy metals, and then there'll be another cassette with I think they have like 4 categories of bacteria, 4 different categories of viruses, virulent factors, which virulent factors are sometimes even worse than like the bacteria or virus. They're like the guts and the pus and the leftover from let's say we killed the bacteria, so that's kind of what's left over. And then also parasites. There's like 4 categories of parasites also. And so basically, when they're doing it, I'll show you. Do we have a picture of the? I think at the end.
That's
Oh yeah,
cute.
here we go.
Yeah.
This is some of the reflexes to the that we use to check for organs. Firstly, we work on what they call, it's checking the autonomic service. First is like checking for what they call a block, where the autonomic service nervous system is blocked. Next level is what they call switched, and it's like left and right side aren't communicating. People try stuff, try different things. It does, works, then stops working. Those people are kind of about going crazy because they've tried everything and nothing's not working. So that's like a second layer, and then third layer we start to get into. Then we get into the organs. So like when someone's blocked or switched, they're in an urgent state. So we've got to get them out of that urgent state right away before we can start to determine and help with some healing.
So all this position is like every patient you have to test for all this position,
Mm-hmm.
all these sides.
Yeah. So we kind of, I could kind of demonstrate a little bit if someone wants to come up. At least the testing. So after the testing, great. Okay, so we find out. Let's say we find out like that one gal. Okay, we found out she had, fish, for instance. When you put on something here, let me do it here too. Let me get a little bit more of the more science behind it too.
Okay, I think that will be seems.
No, that's pardon me, thank you. So basically, like how does this muscle testing work? Okay, I don't have the science behind it yet. I don't have that information. I'll try to get that. But when we do muscle testing, it's most of the time they use the deltoid. You can use other muscles also. And sometimes if a person is really sick or an infant where you can't really do a reliable muscle testing on them, then we use what we call a third party, or don't say surrogate. You can't say surrogate, but you can use another person. And also kind of how it works too, it's like if we all, I remember when I had my class, they had an example of it. Like we all held hands, and then one person had like this light in their light in their hands. So when we all grabbed hands, the light went off.
Do you want to like demonstration?
We have table.
Sure.
Yeah,
We have
we
table,
can make
that's,
the model.
Sure.
Okay, yeah.
Yes, why we move this table here, and then we can make another massage table for here. Okay, that's fine.
So it's much easier here. So kind of how we first of all, how I train someone to do muscle testing too. I just tell them kind of to match my pressure. Very good. No, and see if he goes, I can feel his pressure. If he's engaging his muscle, then I can, it's easier to tell. So arm straight. Yeah. So I just match and I do a very light pressure myself. Some, really, but I do a light pressure. Okay. So, and we're gonna do, this is like a positive negative. So if you put your finger on that finger on your forehead flat. There you go. Okay. Your arm straight.
Yeah, 没关系，没关系，他不用这个。
Okay. And now flip it over. There you go. Just like that. Okay. Yeah, flip it over. Flip it over again. Your finger. There you go. Okay. That's his positive negative. He can't control. You can control that, could you? Yeah. So right here, we'll do it again. Okay. And now down. Okay. Flip it over again. Okay. So that's like his positive, negative. First thing I do, he's testable. All right. Okay. He's testable. Sometimes people are so sick, or they're a child that we can't even test them. I had my first patient was. I was barely trained in this stuff, and my first patient, we needed a third person or a surrogate to train with, but yeah. And okay, so we start here. I guess I'll go through a little scan here. So I'm gonna first check for a block. So I'm gonna put my hand on your. Okay, he's not blocked or switched. Check for a switched. Pinky thumb together. Okay, not blocked or switched. Open for me. Other hand, blocked or switched. I think I thought so. A lot of times my stomach will get really funny when then I notice. So okay, do it again. Okay, yeah. So he's switched. So in that instance, I would grab the cassettes and we'd start testing. So I would start with the food and we put his finger on each one of them. Actually, I put the whole thing down. If there's one of them, his arm will. Actually, we're looking for the opposite. Nah, I don't want to get too confusing, but we're looking for the opposite reaction, basically. Okay, so let's say he came up with, let's see, white sugar. Say he had white sugar. He came up with white sugar. Maybe that was causing it. Maybe that was causing his. And you would have to keep your finger you'd have to keep like this until we fix it.
Mm-hmm.
Yeah, there you go, just like that.
For example, this is white sugar.
Okay, let's say this is white sugar. Yep, he's good with. I use it. I use this to test for all kinds of things. Even it's like, I'll go to the grocery store. Maybe is this good for me or not? Because this is another muscle testing too. They call this the ring test. Important thing about like bias does not belong anywhere. Bias does not belong like in our practice, in NRT or anywhere. Bias just obscures our results.
Mm-hmm.
And so I especially notice this. I really have to keep myself in check when I do NRT, because as soon as I get a tiny bit of doubt in there, it's not working. So I always have to. So usually about twice I have to step out of the room and kind of, reground myself and step back in. So I really have to keep. I have to keep my scientific mind out, honestly, because that scientific mind will prevent, for myself, will cause bias, messes up my results. So, and I think bias just messes up our results in any of our,
Question is,
Yes.
I want to know is like you use your tuition, or you use your mind, or what kind of you use, what kind of feeling you have.
Probably a little bit of both. It's developed into some intuition, some of it. You very much, they've got, a very systematic approach to it. You could, follow it step by step. Some things I've kind of learned on my own that I don't have to do some of the steps. I've learned some Reiki, energy healing, which kind of helped me be able to energetically connect with things. So
Okay, the second question.
yes, second question. I love
Okay.
questions.
Because you just said you have a cascade, right? That's like a test box, right?
Yes.
Something like the different material, for example, like the fish or whatever, that's a herb, something,
Mhm.
right?
Yes.
So my question is that the same testing kit, like kits, with the same as the homeopathic?
It is homeopathic.
It is a homeopathic.
Yeah, they are homeopathic. Yep, they are homeopathic wavelength and frequency. Stuff they figure out on the computer. Wavelength and frequency of different items.
Okay, I just introduced this for them because yesterday, on Thursday, we have a roundtable meeting with homeopathic
Yes.
practitioners too, right?
Mhm.
Because they have a college in Bloomington, homeopathic college in Bloomington. So we had a roundtable together like we're discussing about the case study, right? So
That's very interesting.
Bell palsy, right?
Oh, you're
Right?
right. Yes.
Yes. That's on Thursday. So, because I'm also curious about homeopathic, because this is how to say, if you have some bias, you may think that's like you're using the herbs, we're using the herbal medicine. They may think, oh, it's not scientifically, so we'll have the bias. So it's the same if I'm not know the homeopathic, I may think that's that's why I said I ask you about is that intuition things or is like your nerves how to say muscle testing, right? Response testing. That's why I ask you to have this demonstration, this topic, because I have curious about what we are doing, because this is your tool to choose your homeopathic, like choose the herbs. So yesterday I read the book. The book, like they introduced about the what is the homeopathic 就顺势疗法.
Oh,
I just checked it. I just checked the terms.
Yeah, homeopathic, that's the 顺势疗, because that's actually in Europe, it's quite recognized. It's from German. And also here, I heard about that, but I never know what this. I'm curious about what this. Since they worked, we have to know what they are doing. So that's why I ask you. That's okay. You go.
yeah.
Out,
Thank you.
please.
Thanks
Yeah.
for the question. I'm gonna grab my water here real fast too. Yeah, and feel free to ask questions. Other questions. So let's say we found out what he's got. Let's say he's got what I said, white sugar. Maybe he's got a virus. We'll say number 2. Gosh, we had one patient. Yeah, we have one. One of our docs had came in and she was really sick, and then the second day her lymph just swelled up like this. And so then I didn't do it with my colleague, our front desk person. She's also trained in NRT, really smart. And so with her, we found that she had bacteria, virus, and fungus. And so just 2 days of NRT treatment, and it went down. She was able to get back to work. She was down for about 5 days. And so after a couple of days of some just NRT treatment, which is basically supplements or homeopathic remedies, or we got her back to work. Okay, so after we determine what it is, then we have these test kits at the in Inver Grove Heights. I've got the whole thing kind of set up in the clinic, and so we have all these little vials of, like, standard process. They've got hundreds of different products, and then we have a Nutridyne line that has lots of them, and then I'll have a homeopathic line, and so those are the ones that I work with. I'm trained with. So we find we find what it is, we find what's needed. So basically, we would do the same thing. We find out what it is. We take his hands. He has to keep his hand like that till we fix it. We stick those fingers, and we kind of that's how we would determine the stressor. And we would take the vials and put it on. Yeah, you would just keep your hand there. We put the vials on his body, and then they would tell us, like, okay, is this good or not good? So we find out what is, and we also have a chart telling us what's what would be helpful for each one, and then so we find out what it is, what they need, and then how much. You gotta know how much. You want to have enough, but not too much. So we can also determine how much they need that day, which is really nice because everybody's a little different. We process things differently. And then we have them follow up. Like if they're blocked or switched, which is an urgent state, then we have them coming back like as soon as they can. I try to get them on a week of product, a week of whatever product it is. If it's a food intolerance, they have to be without it for 3 months, and you got to give them time to think about that. People need time to wrap their heads around thinking is, okay, gosh, I got to do without sugar, or, I got to do without caffeine, or I got to do without oats or whatever. So I give them think about it. Your next visit, let's look at a date, and then we'll look at a date, and then I want them to stop because they need 3 months off of it. Want the body, want the body to heal. So we give them the digestive enzymes, sometimes probiotics, sometimes other things are also needed, and then quite often Spanish black radish. It's an amazing, something so simple and stinky. It stinks, but it doesn't make you stink. Will help drain the body. Then we test them probably every 3-4 weeks, depending on also how much they want to go, and to see where things go.
Is it this your product is like just the one component, or it's like the formula as like the herbal medicine?
It could be, but some of them are. I don't know. Are you guys familiar with standard process?
No, no, we're not.
Okay. Well, great thing about standard process is it's whole food. It's food.
Okay,
Concentrate whole food. That's what I love about it. They also have an herb line that is very good too, of high quality, very researched herbs. Also, I tend to try to use food at first and mostly, but then sometimes need the herbs. But then also it's a great, like I go to a practitioner and she uses muscle testing to determine what herbs I need. She does a different kind of muscle testing than I do, but that's how she, May Wan, she uses, did you ever see her in observation class?
May.
You ever see, May, yeah, May
Yeah.
Wan.
Uh-huh.
Yeah, she does like a muscle testing she'll have a couple formulas, and then she'll use that to determine what you need, what the patient needs.
I haven't seen her do it.
Me neither.
Yeah, it's really subtle. She's just kind of doing something. I'm not sure she's doing something against their leg. I'd like to like to know what technique she uses there. But it's just,
So what do you charge for a session like that?
The first one is about, I think, 125. It's probably, it's a little time consuming.
Mm-hmm.
So it's probably an hour and a half for the first visit. And then after that, then they're probably like maybe 30 minutes after that. And so usually the first one's 125. I think the second one, I think it's 75, or I don't remember the prices we have on it. Then of course, then there's the price of the supplements there too, or.
So you mean that's your tool?
Yeah.
Is like the chiropractic, they use that, chiropractic, right? And also the, homeopathic practitioner, they use that, right?
Yeah, they could use that too.
And
Acupuncture.
also like herbal medicine,
Yeah.
Herbalists use that. That's like the tools.
Yeah,
Yeah.
it's just another tool, you know, like part of my toolbox.
I see. So when you get the information from Dr. Geng, and also your experience from this testing, because I try to, learn a little bit like a connection. Do you feel like some kind of the connection between your testing and also about the mainstream testing from the neurology? How do you feel? Do you feel like some kind of a connection?
I believe that I prefer to have all the testing there is. You know, this is just a little tool that I can use to help kind of guide me where I might need to go. Sometimes even I can use it to determine, like segments I need to work on. As a chiropractor, you know, we work on predominantly the spine. I'll be like, okay, do I need to go this direction? You know, do I need to go, let's say, do I need to go this direction, or do I need to go this direction? No, okay. So this direction, that's strong. That direction goes weak. So sometimes I'll do that to also help determine. It's you could probably use it about, and sometimes people use what do you call this? A string with a pendulum. Like some people use pendulums.
What that 是什么？
It's like 一个and then 底下有一个石头，and then 你就这样，and then 它自己用body 的 energy， 它自己抓。
Okay. Yeah, why I'm asking this?
Yeah.
Because actually, firstly, the baseline is like different modalities. It works. It works, so that's why we need to know. The second thing is no bias. Learn each other, right? So, but I want to know like something is like we can test and we can repeat. So it's scientifically that's
Yes.
evidence there. Another kind of the evidence still there, but we can't see that. So that's why I ask you, is that like intuition things, like we're feeling that's like gut feeling?
I've noticed that with that, but I don't. Sometimes that's all I have, But I prefer like sometimes like I say, like there's a category of meat, that covers a lot of there's a lot of different animals, and so sometimes I'll just like say okay, beef, alligators in that category, or bison or elk, to determine if any of those in that category. And so, and the arm will drop on one of those. So, but I prefer if they bring it in. I'm like, hey, next time, bring your stuff in. Because I'm like, okay, do you have food? Like the first visit, I'm like, after we go through, I'm like, do you have any foods that you are questioning? So, I'll, as hocus pocus as it sounds, I don't know. It helps. So I'll kind of energetically, kind of focus in on that thing, and then muscle test it. But I prefer that they would bring the food in, and we have put it on them. I still find it incredibly reliable, with or without them bringing it in, as long as my bias is in check.
I see.
Yeah.
If you do that, for example, like do you have something that you said, oh, here are like so much electricity, like right? Is there so much electricity, like where you will let you feel, oh, that's maybe have some wrong sensation? Because why I ask you that? Because we actually do like surface EMG, we do the EMG. When we do that, it's very high quality. That's we need like something like environment factors
Yes.
that will maybe interfere the signals,
Sure.
right?
Yeah.
So, do you have anything that we think that will cause your like the wrong feeling?
Well, I have to be I have to check my not only my bias, but I also have to not be blocked or switched. Sometimes if I in the beginning it's like I would start getting results that are just if they're as I'm testing, I'm like they're not coming out like, okay, I need to get myself, make sure I'm not blocked or switched. So most of the time for me it's a scar. So scars, so what we use for scars is wheat germ oil, really good on the scar. So I'll put that in my pocket, and then that will square me away. So I often have a colleague that will test each other sometimes. And sometimes I've not been able, like there was one day I was so blocked and switched that I couldn't test that day. So.
Is that like, for example, you can do this, but I can't do this because of different body constitution. For example, you have like high sensitive nerve system, so you can get the signals like I can't get that. You can get this feeling. Is that like some different?
Well, like that feeling part of it is not really part of NRT. It's just something that I've kind of developed. Maybe others have too, but mostly just kind of you can just, you know, if whether you're intuitive or not, or sensitive to energy or not, just even following this procedure, you don't have to be.
Okay.
That itself, as long as you know you're following it, and I mean there's some things that can affect it also. Like sometimes it's sometimes tattoos affect or sometimes wearing all black can affect it. Sometimes, you know, you want to take off the electronics. Sometimes that can affect it. You know, a quiet place.
Okay.
Yeah, those are important. Any other questions?
Do you have any questions?
你从你的神经系统的角度来谈的话，你觉得会有什么问题？
我觉得特别像我们中医讲的那个，比如说脚上、耳朵上那个反射区，特别像这种是感觉，但是它是简单的根据这个脏器在体表的投影位置来决定。我觉得还是
其实这个东西我原来是自己的，
那你现在观点？
所以我要让他做给我看。
我是，因为你不可能根据脏器的简单体表投影来判断它的位置。
Because I'm thinking about, like, you know, if we use that, one thing is it's like something we can visible, but the medicine is how to say 50% science, 50% art. So maybe it's I just want to know, is it like more in the art side? So different people have like a different body constitution and like a different, you know, like feeling. You can get that, or you can't get that, like a different energy level. You can feel that. So that's what I'm questioning about. Is this the tool more in the art side?
I'd say no.
No.
No, it's pretty. It can be pretty rigid
Okay.
with its findings, and is, you know, honestly rather reliable.
Okay.
Some of the, at least, you know, in my experience, it's been very reliable and a really great tool for me and others that I know too. There was a on that I had a study that someone did a massive review of different articles on applied kinesiology, where this comes from, and so there was one study said there was high reliability and two that said it was, you know, little to none. So it depends also on the type of reflex that was used, and so I don't know what the non-reflexive stimulus was. They had two categories. I couldn't get the article to get that part of it, but
Yeah, I'm not like questioning you,
Yeah,
but I
yeah.
just want to like know more about that. So what's the behind about that? And also when I know that like homeopathic actually, and homeopathic Reiki and craniosacral, actually these are all the like different alternative modalities right now. That's in America, but in China actually it's very rare because something, how to say, that's they may say it's maybe trash whatever. Yeah, so but this is a good opportunity. Let me see that, because I've already seen the results, so that's why I am curious about what's the behind, right? And also they use that, the homeopathic, they use the herbs. What's the difference between the homeopathic herbs and also what we're doing? That's we're using the herbs. We're using single herbs, we're using the formula. That's a customized. What's the difference? And also we're using the homeopathic, they use the herbs that's very light dosage, right? Very, very light dosage for the kids. And it works, especially for some of the allergy things, that's autoimmune system issues, and also the autism, nerve system issue, like functional neurologists, and also the brain gut access connection issues, right? So that's why I'm curious about like, because you are using this tool for like how to say, like we're doing, oh, we see the tongue, we see the pulse, right? So this is another way.
Just another little tool that can help direct you in a different direction, you know.
Yeah.
Just
Yeah. Okay, great.
All right, thank you. Yeah, and I've got the whole kit and all set up at Inver Grove Heights if anyone's ever interested in checking it out. So.
I'm very interested.
Yeah?
Because this is very new knowledge for me. So I definitely need more dig in this
Yes.
field and
I
do
wanna-
more research about it.
Yeah, I'd like to try to get to Yulin. So the training you can get some very basic training, like standard process. They give some really good, 1-day trainings. That's how I started. I just started with a 1-day training, and then I was like, oh gosh, I'm getting some results. I guess I'll learn some more, and then so I've only had the basic level, which I actually took twice because I helped teach the class too, or assist the class. And but they have much higher levels too, and so even having a very strong basic foundation, I just get some
I know that.
some good results.
I will do
It
some
helps.
research on that.
And let's
Yeah, because like we're learning in the medical school, usually anatomy. Anatomy that's from the body, not from the alive, like dynamically, and also like practical